Hello, my name is Dr. Andrew Couples. I'm a GP with extra training in minor surgery. I've been performing minor surgery procedures for 15 years and vasectomies for 7 years. I'm also a GP trainer and I train other GPs to do this procedure as well. So the purposes of this video are to tell you a little bit about having a vasectomy, what to expect, and the risks and benefits of having the procedure. So a vasectomy is a procedure to render a man infertile, unable to get a woman pregnant. It's best thought of as being a permanent procedure or a non-reversible procedure. It is possible to get it reversed privately, but it's expensive and not always successful. So you want to make really sure that this is something you want for the long term. We also do it under a local anaesthetic, which means that you'll be awake during the procedure using a little bit of lidocaine, which is a local anaesthetic similar to what the dentist uses. So the usual procedure for having a vasectomy is that I'll get you onto the couch, I'll examine you, I'll have an examination of the testicles and the tubes around that area, just to make sure everything is in the right place, make sure that the anatomy is normal, and make sure the procedure is the best option for you. 99.5% of the time, patients are suitable for this kind of procedure. Assuming everything's all good to go, what we'll do then is we'll give you a clean up around that area with some antiseptic liquid. And then once everything is nice and clean and the bugs are well kept down, what we'll do is we'll give you a little injection just below the base of the penis with some anaesthetic, local anaesthetic called lidocaine. We use a very tiny needle and we're specifically freezing up the two tubes which lie under the skin called the vasa. Once I'm happy that things are well frozen, we'll proceed. This is the only painful part of the procedure, and with every injection you will feel a little bit of pain going up into one flank and then the other flank as we anaesthetize both tubes. After that, there shouldn't be any pain. If there is, you make sure and let me know when we can top things up. You may feel some pressure or tugging or weird sensations during the procedure, but these shouldn't be painful. Once we're sure that you're well frozen, we will go ahead and make a little nick in the skin using a little pen-like device which uses a tiny controlled electric spark to break the skin, again just below the base of the penis. The wound is about 5 millimeters, so it's quite tiny. We'll use one wound, one incision, to get at both tubes. This little nick allows me to get into each of the tubes in turn, to dry up the tubes with electrical current, and then to cut the tubes, and then to separate the two ends of the tubes so that the sperm can't get from the inside world to the outside world. Once I'm happy that there's no bleeding and that everything is as it should be, we'll come out of the wound and the skin will wrinkle closed nicely. There are no stitches or patches required after this surgery. Then we'll sit you up and make sure that you're doing okay, and make sure that you're feeling okay, and we'll let you go back to whoever's accompanying you today. So things to consider about post-operative care. You need to make sure the wound is kept dry for 2 days, just until the body seals the operative wound after about 48 hours. So you can have a gentle wash, a gentle shower 2 days after the surgery. You want to make sure that you're going to have a relaxing few days. I recommend a minimum of 2 days off work. 3 or 4 would be great. And you also want to make sure you're not doing any heavy lifting, heavy exertion over the next few days, just until you see how your body is feeling. It's not a bad idea to wear tight pants, and it's certainly wise to take regular paracetamol or similar over-the-counter pain relief regularly, 4 times a day for paracetamol, 3 times a day for ibuprofen, for a minimum of 48 hours. Once you make sure the pain is really well controlled at this early stage, things should go smoothly. It's also wise to consider putting an ice pack or a bag of frozen peas or something similar in the region of your groin, wrapped in a towel for 10 minutes at a time. This helps reduce blood flow and also gives you some reduction in pain. Over the next few days, as you see how your body is faring, you can return to normal activities as your body dictates. You can also return to normal sexual activity after a few days. And if you notice a little bit of blood in the semen the first time or a couple of times, don't worry, that can be normal and will soon clear. Great. Most guys are back to the usual selves, pain-free, more or less, around 2 weeks. Now, once you've had the vasectomy procedure, you're not automatically infertile. There are still many millions of sperm downstream before we make the cut. And what you need to do over the next 4 months is have approximately 30 ejaculations or more to try and clear the remaining sperm from the tubes. In 4 months' time, a company called Aculabs will send you a postal kit, and this will have a sample pot in it. You put a semen sample in that pot and then send it back by post to Aculabs in England, and they will count the number of sperm that are left behind. So there are 3 options with the semen analysis sample. The first result is fantastic, great. There's no sperm left, you get the all clear. About 80% of guys get the all clear after the first sample and don't need any other samples. The second bunch of guys, 20%, will need a second sample after 3 months. You need to keep going with the ejaculations, and we'll get a second sample, and we would contact you and arrange that for you. Between the first and second samples, 99% of guys have good clearance and have a successful procedure. If you have a successful procedure for the rest of your life, there is a 1 in 2,000 chance that the tubes join back up again. This is very rare, and this is at least twice as effective as the most effective form of female contraception. For 1 in 100 guys, however, the procedure doesn't work. So there's still sperm, live sperm, at 4 months and 7 months. If this happens, we will contact you to discuss your options at that stage. So this is the usual course for a local anaesthetic non-scalpel vasectomy. However, as with all surgical procedures, there are risks to consider, and we need to discuss these with you so that you have a full idea of what you're signing off on. Most of the risks are in around the region of 1 in 100, so uncommon, and some are much more rare, but more significant. So there's a 1 in 100 chance of having a post-operative wound infection at the wound site. Generally what happens is that for a few days you're doing okay, and then things start to get more sore or more swollen after 3 or 4 days. If this happens, speak to your GP, because a course of antibiotics usually fixes the problem. There's a 1 in 100 chance of having a significant collection of blood in the scrotum. Now, it's normal to be a bit bruised and a bit swollen after the procedure. Anything up to the size of an existing testicle is probably normal and will settle over a few days with ice packs and tight pants and analgesia. However, if you have swelling more than the size of an existing testicle in new growth, then you need to take that straight to casualty, because you may need assessment by surgeons. A small number of men will need a procedure to release a collection of blood. We do our best to dry up any bleeding through the process of the procedure, and ice packs and tight pants are helpful, and rest is important to help prevent this sort of complication. So 98% of guys are going to be pain-free, more or less, around the 2-week stage. That means that 1 or 2% of guys are going to have pain which lasts longer. Now, that would be weeks, perhaps into months, and then go away. It's very uncommon to have pain which lasts longer than months, or pain which is particularly significant after this type of procedure. Some gents are at a higher risk of pain. We think of guys who have had previous groin surgery. We think of men who are taking regular high-dose opiates like codeine, tramadol, morphine on a regular basis. Men who have chronic pain syndromes like fibromyalgia or complex regional pain. Severe anxiety or depression may be a factor, and having a general anaesthetic. So if these apply to you, then we will discuss them further later on. It's not uncommon to check yourself after a few weeks and find a little lump or a little bump on one or both sides, just where the cut end of the tubes are. Sometimes that swells up a little bit. This is not usually worrying. About 1 in 100 times it can be uncomfortable or painful. If that happens, have a chat with your GP. It's not uncommon as well, sometimes after a few days, to feel a bit of back pressure into the testes and to feel a bit of engorgement down below. It's almost like the sperm have nowhere to go. This should settle with a week or 2 of tight pants and ibuprofen. Now, 1 in 200 times, we start the procedure, we do 1 tube, and then for some reason we can't access the second tube, and we have to stop the procedure. We make sure and check you really well beforehand to make sure that both tubes are easily accessible before we start the procedure. Regret is an issue for some guys. Sometimes people change their mind. Sometimes men change their mind. Sometimes ladies change their mind. Sometimes your circumstances may change and you might want to have further children. Make sure you've had a really good think about this with your partner, and I'm very happy to discuss this with you later on as well. Now we're down to the really rare things. So there's probably about a 1 in 4,000 chance that you get sick on the table and that we have to transport you to hospital by ambulance. This is very rare. I think it's happened once in Northern Ireland. There's a 1 in 10,000 chance that you have a problem with a testicle after the procedure, that we damage a blood supply to the testicle, where the testicle shrivels up and stops working. That is very rare. We do our best to avoid this. We leave the blood supply to the testes well alone, and we also don't go near the testes during the procedure. This is a very rare complication. So it's important to consider all these risks because, as with any surgical procedure, you may hear information which changes your mind about whether you want to go ahead with the procedure. Otherwise, if you have other questions, please do ask me after this video is over and we can explore those fully before you sign off on the consent form. Thank you for your time.